Welcome to a bit of a video version of the podcast. I am joined by Paul Madden. Many of you know Paul well, and he is a longtime advocate. List of accomplishments, everything from being a specific type 1 advocate within the American Diabetes Association to, I don't know, I met Paul at Friends for Life. You worked at Johnson & Johnson. You are now working with Afrezza and the folks at Mankind, and you have your own company, Madden Diabetes and Wellness. Paul, thanks so much for talking to me.
I'm honored, Stacey. I watch your podcast, and I know that you're getting right information out to us all in our diabetes world, all 34 plus million of us here in the U.S. Yeah.
Well, I appreciate that. I'm grateful that it's generally an audio podcast with these video segments put in, because as you can see, my production is sometimes a little wonky. We hit this at the exact right time for the sun to be setting on my window. So we've got some interesting stripes on me with the light, but we'll work around that.
Yes, we will.
Listen, you're here because you have so much great information about type 1 advocacy, specifically right now around the COVID vaccine and prioritization. Sure. Let's just take a step back. Can you talk a little bit about the situation? We are in the middle to late February at the moment. Mm-hmm. Where things stand. I mean, the U.S. has a bunch of different policies. Where things stand for people with type 1 right now.
Yeah, I'll give you a couple of scenarios of where it stands right now, Stacey. And regrettably, we can't define it well for every state without going into their state COVID medical policy. But generally, the CDC, put out their announcements, and they said something to the effect. I won't quote them, but I'll paraphrase. But they did recognize that type 2 diabetes was a higher risk and a priority for earlier vaccinations. And that is very correct. Unfortunately, their wording for type 1 was far more nebulous, far less clear. And they said that for type 1 insulin-dependent diabetes, we suspect it could be a higher risk. Now, the challenge is, as you know, Stacey, we have approximately 1.6 million people in the U.S. with active type 1 diabetes of all ages, older guys and gals and folks like me, and very young, little babies, little kids, and all the way in between. The type 2 population, it's over 32 million. And so very quickly, within the first few months of COVID, after February, March, they saw the data from the hospitals, from the treatment centers, the ICUs, that said, wow, type 2 diabetes is about a 3.3 times greater risk of serious complications than the citizen without diabetes. So they correctly log that in there. Unfortunately, and we're saddened by the fact, and I and others, it's never alone. It's always a group of us. But I reached out to the ADA, the JDRF, the Diabetes Patient Advocacy Coalition, the Leadership in Diabetes Group, and Children with Diabetes, a group that you and I know well. And 18 groups finally signed on when we sent a letter to Dr. Redfield, who was in charge of CDC. And we said, please, sir, there's some new data, some new science that started to come out, beautiful science in November, December, and a new article just came out in January to say type 1, absolutely. If you get COVID, is at the same high risk level. And one study implied that it could be a little bit higher risk than type 2. So 6 states have made the change and have said, absolutely, let's do it. Some states haven't defined type 1 and type 2 in their state policy, because remember, the CDC allowed the states to determine who gets the vaccinations on their state schedules. I got involved very much in Massachusetts because unfortunately they did distinguish, and they still have not changed the priority ranking for type 1. And we're very discouraged by that. Very discouraged. So the type 1 population, our kids, get no priority. If you're over 65, we can now start to get it just because of our age tomorrow, but that's not enough. We've got to get all people with type 1 diabetes at the same priority ranking for vaccinations. So that's what we dug in. We're trying to get, we have a sense that we're going to get a meeting with the COVID committee, the medical leaders here in Massachusetts. I know others are doing the same. So we only, again, know of 6 states that have put type 1 in with type 2. But as I'm talking to more and more advocates throughout our country, I'm learning that some, again, like I said earlier, don't distinguish, and they allow type 1 and type 2 to be together, both as a high priority ranking. But we don't think that's more than about 20 to 25% of our states. And we don't have a finite number on that. Yeah. So we got to keep pushing.
I'm in North Carolina, as you know,
Yeah.
and they did, not at
Yes.
first, but they did slide type 1 up. And, a question that came up early on, and again, we want it to all be the same. We want we want that type 1 higher, but who would check? And what a burden to kind of put on these healthcare workers who are giving vaccinations. I mean, I get it. If you're, when they open it up to kids, if you're a 12-year-old, they're going to say type 2. But if you're 40, is someone going to be standing there saying, well, what type do you have? What's your A1C? Show me your insulin pump. It just seemed to put a burden on folks.
Yeah, we certainly did with this. We haven't done this, as you know, since the Spanish flu, 1918. But none of us were around. Maybe 30 people were around, but they can't really relay the story very well. They were 1 or 2 or 3 years old.
And I hate to use a little dark humor, but people with type 1 diabetes were not included. They hadn't even figured out insulin at the last time we were doing this.
Well, it was pre-insulin era, exactly right, Stacey. So we've got to keep pushing, and you know it, Stacey. Advocacy, and for everyone who's participating in this, advocacy is about getting the science clear for diabetes. Getting the science clear, having good backing, making sure you have some spokespersons from healthcare who are specialists in diabetes. I'm a psychologist, I'm a diabetes educator. I know my diabetes, my personal diabetes of 59 plus years, and I've been an educator in it for 47 years, so I know it well. But I also realize that I often need to make sure I've got several physicians and other healthcare providers lined up. And that we have done. Several people have said, yes, the Joslin Clinic came roaring through and said, what do you need from us? We've got it. And they just sent me another article today that I can submit to the governor's office and the COVID committee. And that's the type of things that we have to do. There's not enough people that get paid to be advocates. And I want to stress that. And I wish that there were. And I know the diabetes organizations wish they had so much money that they could easily hire more people to do these things. So it really relies on us, the volunteers, all so often to put the pieces together, again, working, though, and supporting those diabetes healthcare providers.
So if someone is an individual, they're not affiliated with a formal advocacy group, and they're in a state like Massachusetts or another state where they haven't put the type 1 priority higher, what do you do? Who do you call?
Yeah, I think most people bombard their diabetes specialist team phone number and email, much more now by the young people especially. And typically, the diabetes professionals in our states know who the advocates are. And if they don't, and they're seeing this, I want to encourage you to find out who your statewide volunteer advocates are, and know the people from JDRF, from ADA, from the diabetes, the DPAC group, Patient Advocacy Coalition. They're quite a remarkable group. There's 2 paid staff and a bunch of wonderful volunteers, some very top senior business leaders who have been in diabetes for a long time, including the nonprofit world in diabetes, and they volunteer their time for this. So the medical professionals should know, and then we, the people living with diabetes, should get to know these advocates also, because there will be other issues. This is a big one right now, but there's other big issues, the whole reimbursement, the medical switching, all of these things that make no sense whatsoever. Yeah.
So with this situation, though, you would think it's better to call the people that are already working on it rather than your congressman or your health department or things like that?
Well, no, I think rather to coordinate with the people that are already working on it, But no, Stacey, you bring up a great point here. You and I and all of us have to be wonderful employers. And by that, I mean our state representatives, our federal senators and representatives, they work for us. Whether or not you voted for them, they are in office and taxpayer dollars pay their salaries and their benefits packages. And again, we've got to be a cooperative employer, but they do work for us. And we have to make sure they understand that this is a priority for 1.6 million people in the United States that live with diabetes. Absolutely. Yeah.
I don't know if you can answer this,
Yeah.
but I'm curious. Do you think that when the CDC put out those guidelines and when states like Massachusetts are kind of pushing down, well, I shouldn't say it like that. When the CDC put out those guidelines and states like Massachusetts aren't listening to advocates like yourself, are they not taking type 1 seriously? Do they maybe not understand it? Don't they think it's just kids? What do you think's going on?
Yeah. So maybe it's not a full understanding, but the medical experts on the COVID committees typically, and I'll speak for Mass, these are good doctors.
Yeah.
They know medicine, but they also are not diabetes specialists. And the thing, again, I'll go back to that does hinder us some when you're trying to collect quick data on a flu, a crisis like this, a COVID crisis, it takes 5 to 6 months to get a big enough group of people with type 1 diabetes that have had COVID. I respect that they went after this from the very beginning with what does healthcare show us? Right. What's the medical condition? Because we got to rank order this. I appreciate that. Even though I'm a psychologist, I always go after what's the medicine say first before I start to speak. And I surround myself with bright people who are endocrinologists, who are brilliant research scientists, and they share things with me so I can understand it and I can pass it along. But we've got to get the message. I tell you what I think is happening. This is a frightening crisis financially for every state, for an awful lot of good families. Some adults are out of jobs for the first time in their lives. Yeah. And maybe they have a child and maybe even 2 children that happen to have diabetes or some other added concern that costs a lot of money sometimes, So it's a bit, some people have gone into more of a survival, and I respect that. And when you're in a survival state of mind, it's hard to process more information coming in. And I'm aware that there are many groups right now approaching, and I'll speak specifically for Mass COVID committee, but it's all of the committees in every state, are saying, how come my condition's not a priority? How come this is not a priority? And I just would say to all of us in our diabetes world, stick with the science, get medical people aligned with you. I remain very discouraged right now, but I remain very positive in the way I state things because we must change this. And that has to change soon. I think the committees are sometimes so overwhelmed with so many emails and so many calls. And that's why I go to groups like Joslin, like Harvard, for their backing. And I've called in a colleague who is a good friend of a friend who knows the governor. So we're doing those types of things that all of us will know someone who knows someone. And boy, you got to do that. You have to in advocacy work. Yeah.
It's difficult to say the least. I'm glad. I mean, I know how I would want to prioritize it, but I'm glad I'm not the person who has to prioritize it.
Very challenging for them.
So difficult.
Very challenging. And that's why they can put a little bit of a protection in front of themselves by saying, we understand the science clearly says this now. So now we must change this. Yeah. And if you stay on the science, and that's it, the science will guide you with the wisest of decisions. Yeah.
I'm curious, Paul, and we'll probably talk more about vaccinations as we go forward here, but how have you been this last year? What have you been up to? I see all of your conference tags behind you. Obviously, we haven't been going to those conferences. How are you all doing?
Yeah, it's challenging for me. Let me personalize it. It's challenging for me, for my sister's family, my brother's family, for cousins, all of us. We've actually done some Zoom calls with cousins. Whoever would have thought I would have done that? I would have just driven, 50 miles away to see my cousin, right?
Yeah.
And so we certainly are doing some of that. And that's been incredibly helpful. I early on, I had launched my business after going into semi-retirement, and we had a family challenge with a health issue with a wonderful, loving family member. So I decided, oops, you're 68 years old, you can step back a little bit and focus more on family right now. And I appreciate that I had that luxury, truly do. But then I realized, and he's doing great, cancer-free for the first time in over a year after 7 years of dealing with a challenging cancer.
Wow.
So we are so blessed. And I realized, oh boy, you better get going. So I launched my business in January of last year, 2020.
Wow.
I had a robust February. And then the day I flew home from the diabetes technology meetings in Madrid, I saw on the CNN screen in English, the first case of coronavirus identified in Madrid. I had no idea what that meant the last Sunday in February.
Wow.
Little did I know that 4 to 5 weeks later, because I've had diabetes for so many years, because I am over 65, I just took a breath and said, you know what? You need to shut down. I certainly have kept doing some Zoom presentations, some FDA work and all of that, but I really basically shut down what I was doing.
I have been very optimistic in an odd way about this. We've been really fortunate that my parents are finishing, as we're speaking, they're finishing their second shots. They're doing that this week.
Yeah.
So I'm very excited.
Good.
But, my husband lives with type 2. My son is 16. He is old enough to get the vaccine. He lives with type 1. We may be in the queue in North Carolina, but we are nowhere near getting it. They're not even signed up for anything yet. From your perspective, you're much more dialed into this. Is this a question of sit tight, it's coming, push where you can? Or is there a voice in your head saying, this is going to take forever? We're not going to get people with diabetes vaccinated until summer or later, or, I'm not sure even what I'm asking, Paul, but I'm just, sometimes I lay awake at night and worry.
As do I. Yeah. Yeah. And so they're opening it up for me at over 65 tomorrow in Massachusetts. So I'll get it, the first one, within the next 3 to 4 to 5 weeks. Okay. At least I have an identified timeline now. But I do worry about the rest of my younger friends. I do. And I would say, again, and this is on the state level now, your state senators and state representatives work for you. The science is very clear that type 1 is comparable to the risk of type 2 diabetes if you should happen to get COVID. And I would say, make sure your governor's office knows that. Make sure the Department of Health knows that. And absolutely call and ask your state senator and state representatives to work on your behalf or your loved one's behalf, because we've got to change this. And the science is clearly there. It's on the ADA webpage. It's on the JDRF webpage. And clearly you can get a hold of the science, and you look up COVID and diabetes right now, or did this morning, and some of the more prominent good studies are listed, including now for type 1 diabetes too.
So I wonder, I don't know if I agree with this, but I've heard a few people say that one of the issues was almost self-created by, at the very beginning of the pandemic, people feeling that maybe it was because there wasn't enough information, but that people with type 1 who got COVID did not have as serious cases as people with type 2. And somehow separating that out and saying, it's okay, we're going to be okay, we don't have to worry as much. Because I remember seeing those posts back then. But as you're saying, the science doesn't bear that out.
If you get it, if you have type 1 or type 2 diabetes, you have no greater chance of getting COVID.
Right.
Thank goodness. So mask, wash your hands, social distancing, all those things, crucial. And I just say to everyone, hang in.
Yeah.
The light is at the end of the tunnel in the months ahead. And I want to shorten it to a few months, not several more months.
Yeah.
And that's why I'm saying for people with diabetes and for our loved ones, and maybe it's your neighbor 3 houses down whose son married the governor's daughter. I don't care what the connection is. It's that important, our health. It really is. And that's networking at the fullest. And it's amazing to me, some of my grandmother, one of my grandmothers was an incredible networker. And I think I probably got it from her and then passed along by my mother,
Right.
And that's what you've got to do right now.
Yeah. And then I would also just be curious if you have, and if you can't answer that, it's okay. I'm curious too, do you think going forward, there are any lessons in this for the diabetes, the whole diabetes community, not just type 1? Any lessons in all this?
Yeah, so I think there are a couple of lessons, and thanks for asking. I think the lessons are that based on the science, standing together, we can change wrong agendas throughout our country relative to diabetes care. In this case, I mean care for COVID, prevention, vaccination, but for everything. And I mean it for every new technology and drug that gets out there. If we stand together, just because you get the CGM, and if your other friend who's a senior or 12 years old doesn't have the CGM, help push for them. We are one family of 34 plus million people with type 1 and type 2 diabetes. I know there are some distinct differences, but there's a lot of commonalities too. And together, that's an awful lot of votes for anyone who is serious about continuing in the political world. And I think we have to approach it like that. And it is a question of the blunt statement, the quality and quantity of life. Because Paul Madden has had access, I had like you and your family does with your son, I have been blessed. My mother and father knew nothing. When I was diagnosed 59 years ago, there were under 3 million people in this country with diabetes.
Wow.
And it was closer to 2 is what I'm told, right? 34 plus million now. It's unbelievable. Yeah. So diabetes really wasn't discussed. In fact, it was, the poor kid, he's got it.
Yeah.
Because people didn't survive.
Yeah.
And my mother and father, with my medical team at Shaw, and I will say, we had a family practitioner. He diagnosed it. I was 9 years old. I was peeing the bed like Niagara Falls.
Sorry.
I didn't know what was going on. And my sheets actually were sticky. So yes, folks, there is sugar in the urine.
Yeah.
And I was heartbroken, and I dropped 10 pounds. I was a healthy little boy. I would drop 10 pounds in 5 or 6 days. And the family doc said to my parents, I was in the room, and he said, Mr. and Mrs. Madden and Paul, I don't do diabetes in children, but the Joslin Clinic is 15 miles away, and I'm going to make a referral over there. And hallelujah, for the next 30 years, Dr. Leo Kroll and his team at Joslin imprinted on me beautifully, on my parents. My father walked me out onto the court when I was 10 at that point, my first full summer with diabetes, and walked me on the court to meet Bill Talbot, the first athlete ever that was named number 1 or 2 in the world that happened to have insulin-dependent diabetes.
Wow.
Bill and I became good friends for the next almost 50 years before Bill passed in his late 80s.
Wow.
But that was the exposure my parents made sure I got. And that's what all of you have to do too, to the best of your ability. one reason I have stepped down after 2 terms and 6 years on the Children with Diabetes board. But I just tell everyone, and it's as you know, Stacey, it's we call it Children with Diabetes, but approximately half of the people who come now are adults with type 1 diabetes. And I forget the numbers. Jeff Hitchcock sent them to me, but over 5,000 people did the virtual education because we couldn't meet in person.
Oh, it was amazing, though.
It was amazing, and you were part of that. Yes, absolutely. But the camaraderie you get from that, and we bring in some of the finest speakers in the world, who say yes, and typically they do it for free. That's unbelievable. Yeah. They fly from all over, and not just sometimes the U.S., from other countries even. Yeah. So it's that type of constant peer support. Because let's face it, our kids with diabetes don't live, probably don't have 6 other neighbors in their neighborhood that are also kids with diabetes, nor do us adults who have type 1 diabetes. I don't know anyone who lives within 3 miles of me. No, that's not fair. I do know one gentleman who's had type 1 diabetes for 65 years. And we've known each other for 50 plus years. But other than that, I don't know who else has type 1 diabetes in the neighborhood. So Martin and I go out for walks sometimes, and it's an absolute pleasure. And we do support each other. And it's the power of support when you're dealing with something you wish the heck you didn't have, and you've got to move through it so you have the fullest, most robust, and the happiest of lives. That peer support can be rather powerful. Yeah, that's why I think a well-run diabetes camp, I think these support education groups that some of the organizations run. That's why I think the podcasts are so crucial.
Thank you.
I think things like this, Stacey, that you and others are doing consistently are very powerful to convey information. And you and I know, as long as people remember that Paul said what he does with his diabetes gives me great results.
Yeah.
But remember, folks, I do it with my medical team who's coached me and always coach me. And if I have ever had a problem I can't figure out the answer to, and I do, I'm a diabetes educator, but when it's a personal thing, you don't stay as objective, and you don't sometimes pull out all the science, right? When you're talking about yourself or thinking about yourself, I pick up the phone. And the young people probably send the email more frequently than I do. That's okay. Whatever your line of communication is, that's the important thing to promote the most robust health, so that diabetes is an element of your life, but never hinders your life.
Yeah.
And that's the goal. That's the goal.
I love it. Paul, thank you so much. I could talk to you all day. You're inspiring on I don't know, I'll probably regret saying this, but you are inspiring on kind of like an everyday getting it done level. You and I are not people that are going to go up Mount Everest. I don't think you've been up Mount Everest.
I have run a few marathon distances, but no, I'm not going to do Everest. I'll leave that to the Will Crosses and the Sebastians and all of those good people. People.
But I just love it. And I'm so glad to hear your family member is doing better and doing well. So stay well. Keep us posted. Thank you for your incredible advocacy. And let's follow up as more information comes in. And you go give him hell in Massachusetts, Paul.
Absolutely. And anyone from Mass listening, call your state reps and senators, please.